guys, this is me, Dr.Jayanti Ghosh. This time I'm back after some 4 or 5 days gap because I was really gathering up materials for my recent lectures for the other subjects. So today I'm going to tell you about dental anatomy, and on my next YouTube show I'll be describing about oral histology. So in today's topic, that is dental anatomy, you have to refer to the book that is known as Wheeler's Dental Anatomy. And in this subject, I'm going to discuss about introduction to dental anatomy, the overview of dentition nomenclature, tooth numbering systems, division into thirds, line angles and point angles. What are line angle, point angles, surfaces, ridges? Questions may be upon the various ridges and surfaces like labial surface, facial, lingual surface, buccal surface, proximal, mesial surface, distal and distal surfaces. And then on the occlusal surface, there are various morphological variations, such as there are cusps, then tubercle, fossa. What's a tubercle? What's a fossa? Fossa is divided into central fossa, triangular fossa. Then your cingulum is having a lingual lobe, ridge, marginal ridge, mesial marginal ridge, distal marginal ridge, triangular ridges, transverse ridge, oblique ridge, sulcus, your developmental grooves, supplemental grooves. Next we come to the chapter that is measurement of teeth. In this we need to know the mesiodistal dimension, diameter of the crown, mesiodistal diameter of the crown at cervix, labiolingual diameter or the buccolingual diameter of crown, curvature of the cervical line, whether it is mesial or distal. And questions may be relating to this also, relating to your what is, like they may be giving a diameter of a crown and describing options may be that which teeth is having such and such mesiodistal or cervicolingual dimension. Then your next chapter is developmental and development and eruption of teeth. In this, the chronology of primary dentition, first evidence of calcification, when is first teeth erupted into the oral cavity, when is the crown completed, eruption of upper and lower teeth, root, enamel, and the difference between primary and permanent teeth in relation to the mesiodistal dimension of the crown, the roots, in which teeth the roots are more slender and ribbon-like and in which teeth the roots are more bulbous. Then your cervical ridges of enamel and buccal and lingual surface, pulp chambers and pulp canals, basis. And your dental anatomy is your basis for conservative dentistry, your cavity and your pediatric dentistry. Next we come to maxillary particular tooths in description, that is maxillary central incisors. From labial aspect, maxillary central incisor is having the mesiodistal diameter is more than the cervico-incisor length. That is why the labial surface, that is why the teeth is more bulging from the labial surface, and labial surface is smooth and the root is cone shaped. On the lingual surface, the cingulum is prominent. Mesial and distal aspect similar in comparison to the cemento-enamel junction. In the incise, and the important aspect of each and every tooth I am describing in detail. Then we come to the maxillary lateral incisors, where in the labial side the crown is more constricted at the cervix in relation to the mesiodistal width. Then mandibular central incisor, the mesial and distal sides are tapered evenly from the contact areas, and in the lingual side there is a lingual fossa. Then we come to the next tooth, that is mandibular lateral incisor, where the tooth is larger labiolingually, that is labial to the lingual side it is larger. Mandibular canine, where the distal slope is longer than the mesial slope. This is often a question asked in AIPG. In case of maxillary or mandibular canine, the distal slope is longer than the mesial slope. Why? Then maxillary first incisor. In case of occlusal aspect, the central foci is determined. Then mesial and triangular foci is also present. Grooves are there. Ridge is high. Then maxillary second molar, where the buccal aspect is having very important tubercle of cerebelli. In the occlusal aspect, there is a central pit, mesial and mesial triangular ridge. Next, we come to the chapter that is forensics, comparative anatomy, geometry and function. In this, we need to know about haplodont, that is single cone, 3 cusp in line, your triconodont, tritubercular molar, quadritubercular molar. Then the next chapter is your orofacial complex form and function, contact areas and embrasures. Then we come to the permanent teeth, where permanent maxillary incisors are important. Maxillary lateral incisors are having a peg lateral shape and a palato-radicular groove. The pulp chamber and the canals are more wider in comparison to the primary tooth. That is why the difference between primary and permanent teeth is important, and there is a table in Wheeler's which you must keep in mind. Then your another chapter is dento-osseous structures, blood vessels, where maxillary artery dividing into external carotid artery, inferior alveolar and superior alveolar artery. You need to know these arteries. Then nerve supply to the jaws and teeth, trigeminal nerve. In detail, trigeminal nerve I have discussed in my anatomy section of YouTube your section, so you can check that out. I'll also paste that link in my description box. Then some questions which I have noted down from your PGI is alternating dark and light bands when seen in ground section light microscopy. The bands are known as Hunter-Shreger Bands. Then which of the following cytokeratin marker is not present in orthokeratinized gingival epithelium? The answer is K19. Other options, other markers which may be present are your K10, K11 and K12. Then if the roots of mandibular incisors are completed, then what is the expected age of the child? The answer is 11 years, because the root of mandibular incisors they are completed by 11 years. So again, that table is important. Another question is supernumerary teeth formation occurs during which stage? Answer is tooth initiation. The next question is negative regulation of BMP is done by which kind of protein? That is noggins. Pulp. Next question, pulp most commonly resembles which tissue? Loose connective tissue. Another question is which that is during tooth formation, enamel formation first occurs at which place? That is your tips of the cusps. True regarding epithelial lining of tongue is stratified squamous keratinized specialized epithelium. In 2014, these following questions were asked. During the cap stage of tooth formation, signaling for the cusp formation is largely controlled by enamel knots. Calcification of permanent teeth begins at which stage? That is birth. Levy space is formed due to what? That is space difference between deciduous canine and molar to their succedaneous permanent teeth. So this is all for today, guys. If you have any doubt regarding dental anatomy, and please, after watching my video for at least 2 times, just go through the Wheeler's dental anatomy. And if you have, after reading through twice, once, thrice, if you have any doubt, you can ask me in my comment section or just WhatsApp me. My number, my contact number and Facebook, all my links are there at my description box. So thank you and have a good day. And don't forget to share, subscribe and like my channel. Love you guys. Good night.